Have you ever wondered why your knees cave in when you squat, and whether or not you should worry about it as much as everyone says you should? Well, in this video, I want to get into that a little bit and hopefully shed some light on that topic. I'm Coach Desi from Team Outlier, and here are 5 things you should know about knee cave. So point number 1 is that not all knee cave is knee valgus. So there is a distinction between true knee valgus, which is where the knees are in an extreme and precarious position all the way inside of the feet, versus just any kind of general inward motion of the knee at all. For example, my knees can come inwards as I'm squatting without ever actually coming inside of my ankles, especially if you're someone who overly forces your knees out during the descent of a squat, which we see that all the time. There's also a distinction between general internal rotation and knee valgus. We'll get into this in a little bit, but hip internal rotation is a normal human movement pattern that we see occurring during squatting, where the femur or the thigh bone and the tibia are rotating inwards together, acting as a unit. This is totally safe and distinct from most knee valgus situations where we see the femur rotating inward as the tibia rotates outward. These opposing forces push that knee inward relative to where the foot is going. And the torsion at the knee joint that this creates can be where problems sometimes arise. Point number 2 is that knees in is a natural part of standing up. Earlier when I talked about internal hip rotation, I mentioned that it's a normal part of squatting. The full story is that internal rotation is an essential part of squatting, as hip extension, which is basically the motion that occurs when we are standing up out of the bottom of a squat, is paired with hip internal rotation, so they happen at the same time. So as the hip extends and we stand up, it also rotates inward. To reverse the squat motion, this has to be happening to some degree. Point number 3, you're probably not going to hurt your knee this way. As I said, most of the time when knees are coming in during squatting, this is an expression of internal hip rotation, not true knee valgus. Those opposing twisting motions at the femur and tibia can cause problems, as I mentioned earlier, but usually this isn't in the form of an acute injury. It's more so long-term wear and tear over time. Valgus is a much bigger mechanism of injury when we're talking about higher impact activities such as sport or while cutting. The injury rate during exercise is incredibly low, and our structures are very resilient, meaning that blowing out a knee is just not something most people are ever going to have to worry about while squatting. Point number 4 is that knee cave can appear more pronounced in women. If you watch any powerlifting meet, even high-level ones, you'll see knees coming in for many lifters, maybe even most of them, but it's oftentimes more pronounced in female lifters. I've even seen, and maybe you have too, knees actually touching together on the way up from a squat. This is largely due to women on average having relatively wider hips than males, which leads to something called a greater Q angle. Simply put, this is the trajectory of the femur as it descends, where for many women, because the angle is greater, the femur actually projects inward from the hips towards the feet. Whereas for many men, that angle is smaller and the femur points more so straight downwards. The result is that for many women, neutral is actually inward, which can make a normal squat look different amongst some male and female lifters. And point number 5, it should pass the eye test. Most of the time, knees coming in a little bit while you're squatting is not a big deal or anything to worry about. But this is where a knowledgeable coach or other experienced eye can be very valuable. A good coach will be able to tell whether this is a problem resulting from stance problems, maybe problems rooting the feet or some other issue, or if this is just not a problem for you. I encourage you to use your best judgment or seek the judgment of someone a little more experienced than you. Well, I hope this was helpful. If you have questions about this, please be sure to leave them in the comments and I will get back to you, along with anything you'd like to see me cover in the future. And be sure to subscribe for upcoming powerlifting content.